Today, have you ever wanted to be like instantly slimmer? Hi guys, my name's Dr Sarah Tonks. I'm a cosmetic physician in London. Today we are going to be doing some facial slimming using injectables. That's botox and dermal fillers. A lot of people think that fillers are going to make your face look bigger and you'll look, chubbier or fatter after you've had that done, and that you can only use botox for slimming. Actually, that's totally not true. A combination of both of them really works best. This is because it's more about the shape of the face rather than worrying about adding more volume to it. So if the volume's in the correct areas, it means that eventually you'll wind up looking slimmer. So our patient today is a huge tooth grinder. You can see her masseter muscle here is, massive. It's huge. She's also got a large temporalis muscle here. Sometimes on people who are clenchers and grinders, you will see that the platysma, which is this big sheet muscle down here, will also be quite strong. It tends to be that if you're clenching your teeth, it's more in the temporalis. If you're grinding your teeth, it's more in the masseter. The size of the muscle is not related to the amount of pain that people can get with this problem. So I have seen some patients who maybe they've got a really, really tiny looking masseter, but they experience a lot of pain from their grinding. Likewise, I see patients who have got huge masseters, but they might not be in any pain. I think you'll agree though that for this lady, if we can just take a little bit off this muscle on both sides, it would look quite nice. I'm also going to inject the chin crease here and just try and make her look a little bit less tired there. She's previously had her lips done elsewhere, so I won't be treating them today. Okay, first of all, let's do the Botox. So we're going to be treating her glabella, which is a frown line, forehead, now the temples. Now remember, this is that big muscle, the temporalis muscle, which is involved in clenching your teeth. Then we're going to treat the masseter muscle, and finally the platysma in the neck. This is really going to take the tension off for her. Now onto the filler. First things first, on top of the cheekbone. Now switching to use a cannula, again to treat the cheekbone. Now micro droplets in front of the ear. This is for lifting. Touch of frost, that's 4 mils. So you can see that by using 4 mils, we do have a slight improvement in the contour of the cheek area, and we're starting to see some lift here. Let's go on and do the next 4. I'm putting more in this micro droplet technique in front of the ear because I think that worked really well for her. This particular technique is very good if you have hollowing in front of your ear. I'm now attacking the chin crease with a needle, and we're going back to do the front part of the cheek. Yo ho ho, that's 8 mils. Again, you can see that we're making some progress here. She's not swelling up too much, so hopefully you guys can see that we're really getting some progress here with the cheek. We're starting to unfold the chin. I think you can see the direction in which we're going now. We're going to do some temple filler and then the angle of the jaw. Now we're taking that cannula back and treating the marionette zone and moving across to the chin crease. That's pretty much it. So let's see how she looked about 2-3 weeks after the procedure. So remember, it takes a few weeks for the Botox to work. So let's just have a quick look at her and how she looked when she left the clinic. So what we can see there is we've got some really nice improvement in the cheeks and the chin, and everything appears a bit more lifted, but you don't really see the benefit of the Botox yet. So when we then flip to the follow-up image, which was taken 2 to 3 weeks later, you can see that it's really kicked in and her whole face now looks much slimmer. So using this second image, we can see that now the jawline looks much straighter because this large muscle here has been removed. We can also see that there is a bit less bulk in the temple area, even though I have injected the temple. I know this is a bit counterintuitive that I'm putting Botox in there to slim the muscle, but then I'm putting filler in there afterwards. The reason is the filler goes deep and it's more to lift up the eyebrow rather than it being a functional thing. So I'll often use Botox, for example, to slim the masseter, but then put filler in at the angle of the jaw behind where the masseter is, because that will give you a kind of a more cut look there. Let's have a quick look at her smiling to make sure she hasn't turned into a goblin. You can see, again, looks pretty good on smiling. We've retained those little lines around the eyes. We didn't do any Botox there. However, underneath the eye does look a little bit better. This is probably the most interesting part. So can you see here, this part of the face is straight and maybe even slightly outwards facing. Here, we've got a V shape. Okay guys, that's it for this week. I hope you enjoyed the video and that you liked the results. Don't forget to come back next week where we will be doing more of the same. I will see you then. Shabam.